A colonoscopy is a medical test that allows your doctor to check your colon and rectum for issues like ulcers, swelling, bleeding, polyps, or tumors. The tool used is called a colonoscope, a thin, bendable tube with a light and camera at the tip. It's inserted through the anus into the rectum and gently moved through the colon until it reaches the cecum. Often, it can also go slightly into the small intestine, called the terminal ileum. The camera sends live images to a screen so your doctor can inspect the colon. The tip also has a light, channels for air and water, and a space for small tools. Water or air may be used to clean the colon and get a clearer view. Tiny forceps, loops, or snares can be passed through the scope to remove polyps or take tissue samples, biopsy, to check for cancer. The procedure usually takes 30 to 60 minutes and is done in a hospital or clinic by a specialist called a gastroenterologist. You'll get medicine to help you relax and lie on your side during the test. The doctor slowly guides the colonoscope through your colon, bending it around curves. They may press on your belly or ask you to shift positions to help the scope move. A high-definition video shows the colon's lining in real time, and photos may be taken. A little air is sometimes pumped in to widen the colon for better visibility, which might cause mild pressure or cramps. Taking deep breaths can help. Finally, the scope is removed while the doctor checks your bowel again. If polyps or unusual areas are found, they'll be removed and samples will be tested for cancer. Most polyps aren't cancerous but can turn into cancer, so they're taken out. Tools like wire loops or snares are used, often with a technique called snare polypectomy, where an electric current cuts off the polyp. Since polyps have no nerves, removal isn't painful. Afterward, you'll rest until the sedation wears off. You might feel some gas or cramps, but it won't last long. Because of the sedation, you'll need someone to drive you home. Plan to take it easy for the rest of the day. Before leaving, your doctor will discuss the results with you. Now we'll uncover the 8 most common warning signs of colon cancer. Colon cancer is one of the most common cancers worldwide, and while it often develops silently, there are warning signs your body may give you. These symptoms can seem subtle or unrelated at first, but recognizing them early can make all the difference. When caught in its early stages, colon cancer is highly treatable, with survival rates dramatically increasing. This is why understanding these signs and acting on them is critical for your health. In this script, we'll uncover the 8 most common warning signs of colon cancer. While these symptoms don't always mean cancer, they are your body's way of signaling that something isn't right and should be checked by a healthcare professional. One of the earliest and most common signs of colon cancer is a noticeable change in your bowel habits. This can include diarrhea that persists longer than usual, constipation that doesn't resolve with typical remedies, and a sudden change in the consistency or shape of your stool, such as narrower stools. These changes may indicate a block or narrowing in the colon caused by a tumor. While occasional bowel irregularities can happen due to diet or stress, persistent changes that last more than a few weeks should be taken seriously. Seeing blood in your stool is always a red flag. It could appear as bright red streaks or darker tar-like stools, known as melena, which indicate older blood. Blood in the stool is a potential sign of colon cancer, as tumors in the colon can bleed. It's important to note that blood in the stool can also result from conditions like hemorrhoids or anal fissures. However, you should never assume it's something minor. Only a healthcare provider can determine the cause. Persistent abdominal pain or cramping is another symptom to watch for. This discomfort may feel like bloating, gas, or a constant ache in your stomach area. As a tumor grows, it can obstruct the colon, leading to pain or cramping as your digestive system struggles to move stool past the blockage. If abdominal pain becomes frequent, severe, or doesn't resolve with typical treatments, it's essential to seek medical attention. Sudden, unintentional weight loss can be an alarming sign of colon cancer. Cancer cells consume a significant amount of your body's energy, and the disease can also interfere with your body's ability to absorb nutrients from food. This weight loss is often accompanied by a lack of appetite and fatigue. While there are many reasons for weight loss, Experiencing it without any changes to your diet or exercise routine is a signal that something might be wrong. Feeling constantly tired or weak can be another sign of colon cancer. This isn't the kind of fatigue that a good night's sleep can fix. It's a deep, persistent exhaustion that doesn't go away. Colon cancer can cause anemia, or low red blood cell count, due to slow bleeding in the colon, which depletes your body of oxygen-rich blood. Anemia can leave you feeling drained, lightheaded, and unable to focus. Do you feel like you still need to go to the bathroom even after just finishing a bowel movement? This sensation, known as tenesmus, can be caused by a tumor in the rectum or lower part of the colon. A tumor can obstruct the passage of stool, giving you the sensation of needing to go when your bowel is already empty. If this feeling becomes persistent, it's worth discussing with a doctor. Everyone experiences gas and bloating occasionally, but if these symptoms become chronic or unusually severe, they could indicate a deeper problem. Colon cancer can cause blockages in the digestive tract, leading to trapped gas, bloating, and a sense of fullness even after eating small amounts. If these symptoms don't improve or are accompanied by other signs like abdominal pain or changes in bowel habits, seek medical advice. Bright red blood or discharge coming from the rectum is another warning sign of colon cancer. This symptom may occur with or without bowel movements and is often mistaken for hemorrhoids. However, any form of rectal bleeding, especially if it persists, should be evaluated by a healthcare provider. While colon cancer can affect anyone, some factors increase your risk, including age. The risk of colon cancer increases after age 50. Family history. A family history of colon cancer or polyps raises your likelihood of developing the disease. Diet. A diet high in processed meats and low in fiber is linked to an increased risk, and lifestyle factors, smoking, heavy alcohol consumption, obesity, and lack of exercise also contribute to higher risks. Medical conditions such as inflammatory bowel diseases like Crohn's disease and ulcerative colitis can raise your risk. Understanding these risk factors can help you take proactive steps to reduce your chances of developing colon cancer. It's crucial to remember that experiencing one or more of these symptoms doesn't automatically mean you have colon cancer. However, these signs should never be ignored, especially if they persist for more than a few weeks or worsen over time. Early detection is key. If colon cancer is caught in its early stages, treatment is highly effective, and survival rates are significantly higher. Talk to your doctor about regular checkups, especially if you're over 45 or have a higher chance of getting the disease. Routine colon cancer screenings, like a colonoscopy, are key for catching problems early. A colonoscopy helps doctors spot and remove polyps before they can turn into cancer. Most people should start screenings at 45, but those with a family history or other risks may need to begin sooner. Colon cancer is dangerous, but often preventable. Knowing the warning signs, like changes in bathroom habits, blood in your stool, belly pain, or losing weight without reason, can help you catch it early when treatment works best. If you notice any of these, don't ignore them. See your doctor right away. Taking action early could save your life. By staying aware and taking control of your health, you can greatly lower your risk of colon cancer.